A lady shared a brilliantly written, quite amusing piece with regards to hair growth in the menopause on one of the groups today, and this prompted me to discuss hirsutism. So hirsutism is excess hair growth, but important excess hair growth in a male pattern. So some ethnic groups can in fact experience hair growth that is seemingly too much. But remember, what is more important when we assess hair growth is not necessarily the amount at the time, but the rate at which it is growing. When do we know that hair growth is abnormal? So we've got this visual analog scale that we use in premenopausal women. We call it the Ferryman-Galway score. And this looks at hair growth in the 9 androgen-dependent areas, such as the beard area, the upper lip, chest, and so forth. So if the Ferryman-Galway score is sufficiently elevated, then we would consider that there might be a pathological cause or an underlying abnormality that causes increase in androgen, and therefore we need to investigate it. In the perimenopause, however, women often experience slight increased hair growth, and this seldom meets the criteria for further investigation. So why does this happen? So first of all, as we age and as we gain weight, our sex hormone binding globulin decreases. Now, the sex hormone binding globulin is a protein that binds testosterone tightly, and if you've got too little or there's a reduction in your sex hormone binding globulin, for whatever the reason, there will be more free testosterone around to stimulate the hair growth in these areas. Also, we know that the 2 cells in the ovary that secrete testosterone that is subsequently transformed into estradiol in every woman might not degenerate at the same pace or at the same time. So we often find that the granulosa cells, which predominantly produces estradiol or estrogen, can in some people degenerate much quicker than the theca cells that produces predominantly testosterone. So you've got this temporary imbalance in testosterone and estradiol, and therefore you get some hair loss on the scalp area, but some extra black hair growth around the chin area and so forth. When we consider hirsutism or male pattern hair growth or hair loss, it's important that these hairs are the black thick ones. It's not the vellus hair that we sometimes see on our arms that we can get with some medications such as anti-epileptic medication. So when we consider hirsutism or androgen excess, it must be this dark hair in the androgen dependent areas. And one of the clues that there's something severe underlying with regards to the cause of the androgen excess is the rate at which it increases.